Hello everyone, I am Dr Shivalinga Swamy. I'm a consultant pulmonologist, chest physician, working at Trustwell Hospitals and GC Road, Bangalore. Today I am here in front of you to discuss about a very common disease which is a biggest problem faced by all Bangaloreans is asthma, bronchial asthma. Basically involves the lungs, mainly in the airways, where if someone is sensitive to the external allergens like dust, pollen, fumes, as well as cold air in breeze, and they will have a sensitive airway wherein there will be bronchial constriction and there will be secretions inside the airway which will effectively narrow the inner diameter of the airway and causes wheeze. So whenever a patient is having asthma, whenever he gets exposed to these eruptions or dusts or chemicals, we will trigger this asthma allergic reaction in the airways. They will have cough, with or without thick expectoration, thick phlegm coming out, and they will have breathlessness and wheezing. Wheezing is noisy breathing. Whenever they breathe, they will have the noisy breathing, and they feel difficulty in breathing when it just tightens. And many of these people are also associated with running nose and some blockade, which we call it an allergic rhinitis. It is a spectrum of same disease where they have their upper airways as well as lower airway allergic symptoms. So this disease is very much prevalent in India, especially in metropolitan cities like Bangalore, where there is a lot of dust and pollution. This can be easily recognized where you get exposed to dust, pollen, or pollution, excessive fumes, and you get this cough and breathlessness and wheezing. You must consult a pulmonologist who will help you in diagnose and treat asthma very effectively. One thing you should always know that asthma is a very much controllable disease with medications. Asthma is not completely curable because you are sensitive to external allergens. So you must control these allergic reactions happening in your airway. We do something called spirometry, pulmonary function test, in order to know what is the severity of this problem, how much is the obstruction, how much severity of the problem, and few blood investigations which will help in diagnosing what kind of asthma and how much you are suffering from. And the very effective treatment which is available for treating asthma is inhalers. And inhaled medications are the key for treating asthma. Inhaled medications, they directly move inside the lungs in the airways where they are supposed to be acting, and they act effectively on the surface. They hardly get absorbed into the blood and they hardly have any side effects. The inhaled medications, the dose is almost 500 to 1,000 times less than what we give in the oral form. So this contains bronchodilators as well as inhaled corticosteroids, which is the mainstay of treatment. The dose of corticosteroids, what we use in inhaled form, is way lesser than what use in oral form or injectable form. And regular use of inhaled medications without fail, whether you have symptoms or not, will help you get rid of a severe form of the disease, and also you can have a very good quality of life. There are some other anti-allergic medications which we also use for treating asthma. Prevention is better than cure. As we all know, because of COVID, we all are wearing masks. So anyone who is having asthma or allergic airway have to use thermally anti masks to avoid exposure to dust, pollution, and fumes. Whenever you are walking outside, please use a mask. Avoid these stimulants which will cause allergic reaction and asthma exacerbation. First thing is that. Second thing is use of inhaler on a regular basis so that you can prevent and treat the disease very effectively. Thank you.